Hello. Hello. Hi, everybody. Hi from Hospice Nurse Julie's bed. How do you guys feel about that? I thought I'd take it a little casual today. Hi, Doris. Hi, Teresa. Hi, something Rain. Don't take that personal. I can't pronounce anyone's name. I'm awful at pronunciation. Zachary, Julie, teacher, Lori, Charlotte, a lot of old faces I see here. Mary. Hey, Steph. Topo Chico, you guys. The best. Robin, David C., Catherine. Peace out, Lisa. Hey, what's up? My God, so good. Welcome, everybody. Come on in. If you are just joining my live for the first time, I come here every Thursday, usually every Thursday, 5 p.m. Pacific Standard Time. I'm not always this casual in my bed and sweatshirt, but it's like a rainy day here and I want to be. Hey, Nicole. Yes, Roy, my little doggy. He's not here right now. Darlene, Lourdes. I work with a Lourdes. Hello. Joanne, Nancy, We the North, Peta. Hey, Mary. Hi, Diane. Just letting everyone kind of come in these first few minutes, just me saying hi, and then we'll get to it. But just saying hi. I do have a special announcement today. Now, a lot of you guys got this special announcement last week, but but it's a kind of like pretty official today. So I'll make sure I get everybody. Hey, Amy. Hey, GR. Hey, Joan. Hey, Linda. Hey, Dolly. We do not turn off pacemakers. We do not need to turn it off. We only need to turn off pacemakers if it has a defibrillator with it. If it has a defibrillator, meaning it can shock someone out of a rhythm, yes, we will turn it off. But if it's just a pacemaker, there is no need to turn it off. Yeah, a lot of you guys are in snowy weather. I'm in Los Angeles, so it's sunny, but it was actually rainy today. Hey, Kathleen. Thank you, Linda, for reading my book. Grits says, I have end stage liver disease. I'm afraid. I'm not afraid of death. I'm afraid of the journey to get there. I think not knowing what to expect is what scares me. Hell, Grits, you're in the right spot. I have many videos about end stage liver disease. So a lot of it you probably have already experienced. So I don't know if you have ascites, but a lot of times there are symptoms that come along with end stage liver disease, but it's nothing that hospice hasn't handled before. You know what I mean? So we can handle pain. Shortness of breath kind of comes from ascites that may come when your abdomen gets big with fluid. Usually, we always suggest someone with liver failure, if they have a lot of ascites, we say to make sure they come on to hospice with a drain in their abdomen already placed. So that's something you can work with your doctors with if that's something that is going on. So it's you're in good. You'll likely be in good hands, and I'm really glad you're here. And watching any of my videos about end stage liver disease will likely help. Oh, Darlene, I'm so sorry. When someone's in multi-organ failure, I'm not sure how they can die so fast. Everyone's different. It could be because of the multi-organ failure. So if she's had multiple organs failing, you can die pretty quickly from that. But I don't know your daughter's case, so it'd be hard for me to know why it happened so fast. Yes, I can't pronounce your name, but it's like bitter. I don't know. I can't pronounce your name. I'm so bad at pronouncing names, but it says feeling a lot of guilt for not being able to take care of my parents anymore, and they have to go to assisted living. Yes, I hear that a lot, and I mean, I get it. I get it, and our country is not built in a world. We are not to be able to help aging people. You know, we don't live in a society anymore where like that's built into our society. And it's really unfortunate and maybe that will change one day. But we are living in a society where you have to keep working to keep living. And if you're working, how can you take care of your aging parents? It's not fair. It's not your fault. It's not anyone's fault. It's like the world we've slowly grown into. It's really sad. It's really hard. I'm so sorry you're feeling like that. A pacemaker is not considered life support. A pacemaker runs on the electricity of the heart. Once the electricity of the heart stops, so does the pacemaker. And even if the pacemaker doesn't stop, the heart will still stop. Pacemakers are just kind of like adding to things. So even if you stop being paced, it wouldn't necessarily make you die. A pacemaker is not fully keeping someone alive. It's keeping their heart paced so they don't have symptoms, but that's all. Okay, welcome everybody. So now that you're all here, I can stop being so, and then I will get to answering questions. So please don't get discouraged if I haven't answered your question yet. But I do have an announcement. My book that many of you have read and is a New York Times bestseller, thanks to you. It's called Nothing to Fear. I am officially today announcing that my journal, my Nothing to Fear journal, that's going to be the buddy of my book, is out. And it says questions and reflections for demystifying and planning end of life. So if any of you have read my book and you're kind of like, yeah, but where do I go from here? Like, how do we do the things you're telling us to do? This journal will help with that. Anyone that's having grief or anxiety or really just wants to know where to start, my journal will be officially, now it's not out, it's just out for pre-order. But pre-orders help me. So if you guys like me and you want to help me and you're interested in the journal, buying it now will help. Now you don't have to buy it at all. If you don't want to, that's okay. But if you are going to, buying it now helps. And it's officially out. And I have officially partnered with a place called Porchlight. And Porchlight are selling a bundle, the book and the journal together, which I know many of you already have the book. But if you want a second book to give to somebody else, the book and the journal together, the first 100 copies sold will be signed by me. So if you want a signed book, not journal, but book, you buy this bundle from Porchlight and you'll get a signed copy from me. Let me actually put that in the chat really quick. Hold on. Let's see. Copy. See if I can do this. See if I can actually do this, guys. Paste. There you go. So that promo that I just put in the chat, if you don't need to click on it now, but if you do click on it, if you click on that, you can buy the bundle, which is my book and the journal. And the first 100 people that do it and sign up for a signed copy will get a signed copy by me. So there you go. There's the surprise. You guys are literally the first to hear it. I haven't told anything yet, except for last week's people on live. Heard it here first. Do hospice houses have patients access associates? What's that? Do hospice houses have patient access associates? What's that mean? I don't know what that means, Rain. If you can explain it, hopefully I can answer it. Welcome, everybody. Come on in. I'm Hospice Nurse Julie, in case you don't know. I go live at 5 every Thursday, Pacific Standard Time. Thank you to everybody saying thank you. Please talk amongst yourselves in the chat. If you can answer questions, please do. Thank you to everyone who bought my book already. My journal is out now. It's basically a like in conjunction with my book to help you plan for the end of life. Please buy it if it's interesting to you. If it's not, that's okay too. Why is it so hard to increase blood pressure with meds compared to when you have high blood pressure where it's easier to bring it down? That's a great question. I think what it is it's easy to increase blood pressure when you're in a hospital setting using IV medications, but they don't have those medications in pill form. In pill form. But you have to do a lot of stuff to increase. There's a lot of issues when usually when your blood pressure is dropping and you're vasodilating, right? That's a little more serious. Now, vasoconstricting causing hypertension is serious too. It's more serious in the long term. Usually, if you're vasodilated though, which is making your blood pressure drop, there's a lot of things going on. So it's not a quick fix. Oh, thank you, Chad. Patient access associates are those receptionists who work at the front desk at offices. Oh, okay. So, Rain, only because I can't pronounce your first name because it's me, not you. But Rain, they probably have those. I've never worked in a hospice home, so I don't know, but I bet they would. Thank you to everyone who's a hospice volunteer. Sorry for a stupid question. Are there any things to notice if a person has a year or less? His chemo stopped working. They put him on. Thank you, Chad. I mean, usually if someone has cancer and someone's given them a year or less, that usually means that they will be eating a lot less. They'll be sleeping a lot more, eating a lot less, sleeping a lot more. Generally speaking, if someone is on chemo and it's not working anymore, and who knows what will happen, right? Who knows? But what I like to say is I would treat it like we kind of do know. And like what you kind of do know is he likely has, I'm saying he, yeah, I think you said his. So he likely has a year or less, which is not long. So you knowing that, how do you want to spend your time with him? Right? You can't make him, it's not about like making him know this or like, unless you want to talk to him about it. But I would say just try to be there for him. Spend your time as precious time because it is. Don't force them to do anything. You don't really have to look out for anything, but you can just try to be as present as possible. How do you know it's the right time for MAID since the patient has to do it themselves? Usually the patient, if they have to do it themselves, the patient will tell you when it's time. Let the patient decide. After my dad passed, his body jumped. And add that to the disturbing things you witness. I knew it happens, but I wasn't prepared. Amy, what's crazy that you said this is that I literally made a video about people and moving after they die. So that's coming out in the next couple weeks. Sorry you had experienced that. That is really scary. Deborah, I see those ladybugs. I love that. I love that. My mom passed last year. She had the death rattle and she had like a white mist. Is that normal? A white mist coming from her mouth or a white mist just generally leaving her body? Many people talk about a white mist leaving people's bodies, but I've never seen it. Doctors should never give a definite date for someone's life to end. Barry, I kind of disagree. I get what you mean by that. I think I get your sentiments. But technically speaking, I do think people have the right to know if a doctor or nurses are around a certain type of disease. Let's say some kind of like pancreatic cancer or something, and they see it day in and day out, and they see the progression day in and day out. We do owe it to that person to let them know, hey, this is what we know due to our professional capacity, and you likely have 6 months or less to live, or you likely have X amount of time to live. I think we owe it to them to tell them that so they can make choices, because there are some things that we do know. So this idea of like, you never know, only God knows, I understand that. And I do believe that to an extent, but we still need to tell them the facts and the stuff that we know as working professionals that have seen this day in and day out. Does that make sense? My friend died from a buildup of calcium. What would she have felt? What could have caused it? Many cancers can cause this. Your liver not functioning can cause this. Kidneys not functioning can cause this. Many things can cause this. And she likely felt very, very tired and peaceful. High calcium levels just put you to sleep and make you feel very tired, so you don't feel pain from that. MAID is medical assisted in dying, and it's legal in Canada and many other countries, and it's legal in the United States in 11 different states. But the patient has to drink the medication themselves. Um, and let's see, my sister had dementia, 9 years. One day her eyes were staring at the ceiling and her mouth gaping open. Finally came out of it. Your thoughts? There's no real thoughts there. I mean, that just stuff kind of happens. I think people go in and out of awareness, in and out of consciousness. And when they're getting very close to the end of life, their eyes usually stay open because it takes muscles to close your eyes, and your mouth usually hangs open because it takes muscles to keep your mouth closed. And you can either be like that because you're actively dying, or you could be like that because you're kind of getting close to actively dying. So you're in and out of consciousness. You can kind of snap out of it and blink your eyes again, close your mouth again. But it doesn't necessarily mean anything. A lot of stuff at end of life doesn't always have meaning. But because we're not used to seeing it, we want like answers to all things, which I understand. I relate to that. I relate to wanting that. Hello to 265 of you. If you are just joining, I'm Hospice Nurse Julie. In case you don't know, I come live every Thursday on YouTube at 5 p.m. I just announced that I have a new journal out that goes in conjunction with my book. My book is called Nothing to Fear. It is a New York Times bestseller, thanks to you guys. And now the journal goes along with it. It's questions and reflections for demystifying your life and planning end of life. It's available now for pre-order. If you pre-order, it helps me. And I also have a deal going on right now with Porchlight. It's somewhere in the chat, where if you buy the bundle, the book and the journal, you can get a signed copy of the book, and there's only 100 available. So if anyone ever wanted a signed copy of my book, you can get it now. You can get it now. No pressure, though. I'll put it in the chat again. Hi, Hospice Nurse Julie. I recommend all your videos all the time. Thank you so much. Thank you, everybody. If I haven't answered your question yet, please ask it in all caps so I can see it. Bye, Rain. Thank you. Tina, they have to put you in some kind of like little twilight to put the drain in. Organ failure, you're usually pretty unconscious if you have multi-organ failure. There could be some pain and stuff in there intermittently, but not necessarily. Why won't a doctor give prognosis of cancer patient when we ask for one? His answer is, we can beat this. Maybe that's real. Maybe it's a certain type of cancer that there isn't a prognosis. If it is a type of cancer that is a terminal type of cancer, and the doctor's still saying that, I would truly ask if there's like another oncologist, because a lot of times oncologists kind of work together in a system. You could always ask for another oncologist, because that is pretty crazy if they keep saying we can beat this, if it's a cancer that we know is terminal. You also can have a sit down conversation with him saying, you saying we can beat this isn't helping us. We'd actually like to know the progression of the disease. So maybe this person won't be dying from it anytime soon, but if they are going to die from it, we'd like to know the progression. But maybe this doctor is kind of like, no, listen, this is the disease we can beat. There are cancers where it's like you can beat it. When I say quotes, it's because like you go into remission for, let's say, 5 to 7 years. That's not beating it, but you are in remission. You're not going to die in 6 months. So it's about having an open, honest conversation, calling them out if you think they are being insensitive. And if you can, ask if they have a colleague you can work with instead of them. Why do people have the death rattle? The death rattle happens at the very, very end of life, during the actively dying phase. And people have the death rattle because, hold on. They have the death rattle because We are creating saliva in our mouth, and then we swallow it. But at the end of life, our body stops swallowing it, but it continues to create the saliva in our mouth. So the saliva sits in our mouth, and our mouths hang open like that. And then with every breath, it creates a gurgling noise. So that's why we have the death rattle. Is it normal for legs to be contracted with Parkinson's? Yes, if it's very, very end stage. I can see why it's complicated to deal with discussion of recovery versus death. Yeah. Yes, yes, yes. Thank you for all your videos. How do you mentally not get affected by so much death around you? Well, because I was an ICU nurse for many, many years, I don't necessarily feel like death is the worst possible option. So I don't necessarily think death is necessarily that sad since it's going to happen. And I truly believe that if you die on hospice, um, it's a better way to go than most ways. You can prepare for it, you can be comfortable, you can be with your friends and family. Death is inevitable. So dying on hospice is a somewhat peaceful death. So I think I just have a different view of it because of my experience from being an ICU nurse. What's your experience from people dying from malignant pleural effusion? Rebecca, it's kind of typically the same with anyone from cancer. They usually just have some shortness of breath. Sometimes they have drains in their lungs so they can have that fluid drained. Their main symptoms, shortness of breath, sometimes pain, but it's the usual stuff. Sleeping a lot, not eating and drinking, sleeping a lot, not eating and drinking, losing a lot of physical abilities. It doesn't stand out to me as something that's like extraordinarily painful or awful or anything like that. It's like the typical thing you'd see with most people at the end of life, which is just a lot of sleeping, not a lot of eating, maybe some shortness of breath, maybe a little bit of pain, and then a lot of debility, meaning like not able to get up and move and do things they normally would do. But that's for anybody. Hi, Ria. I'm glad you're here. Thank you for being here. I'm sorry about your sister. I don't necessarily see a question, so I can't answer, but I want to acknowledge you. Thank you, Amy. Almost everyone experiences the death rattle, but not always. Depends on how you die. Yes, and I have several videos on all types of stuff. If I don't answer your question, I have so many videos. My brother went on hospice. What are some signs of transitioning? Kent, I would recommend you watch a lot of my videos. They're all labeled, but some signs of transitioning would be sleeping more than they are awake. So sleeping more than they are awake. Barely eating and drinking. I'm talking a spoonful of or two of food a day. Those would be signs. But what I would do is try to be present in the moment and not super focus on like the things we need to know. Like I know, so what happens is, which I really relate to, is I think people can feel really out of control during this time. So they try to seek all these answers to try to maintain control. When really it's like, this is just the time to be there if you can, no matter, I would just be there. Like I wouldn't wait until they're on their last legs, to get there. Unless that's the relationship you have with them. I would say like time is of the essence. And just know that like you ask yourself, are they clean? Are they safe? Are they comfortable? And if they are, you're good. But the main things you'll see is sleeping, 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 not eating or drinking, not eating and drinking, not eating and drinking. And watch my videos. Those will help too. I hope that helps. Sasuke, I have no idea. Do you think they'll ever change the law to die with dignity? To make it a federal law? I don't know. I certainly hope so. but I don't think not now, not currently. Did you ever wanted to teach hospice, do a seminar? I am planning on getting some classes out there. When those are available, I will let you know, but they will be online. I am a mandated reporter. I have reported things if I didn't think people were getting cared for well, and I thought I was like purposely done, or there was something like that. Then we are mandated to call Adult Protective Services. Do current Medicare cuts affect hospice services? As of now, I haven't heard that, but that has definitely been on my mind. I just haven't spoken of it. Instead of saying sorry for your loss, what would be another phrase? I think you could say sorry for your loss. Um, I think we can say stuff like I think we can mention the person's name, say who they are, right? I'm so sorry to hear about your dad. I'm so sorry to hear about your dad's death. Like, I would love to be there for you. I'm going to bring over something for you, something like that. So you can bring up the person who has died. I think a lot of times we try to be vague because we don't know what to say and we're afraid to say their name and stuff. So you can definitely say, I'm sorry for your loss. You could also say, like, I'm so sorry to hear about your mom's passing. Now, I'm trying to get everyone used to saying death and dying and not passing, but I get it. It's a process. So you can say, I'm sorry to hear about your mom's passing. I'm so sorry to hear about your dad's death. I'm so sorry to hear about Johnny, Susie, whoever it is. Just say something. Just say something and offer your support. Oh, Mary M. Julie just ordered your bundle. Hope you sign it. Oh, yay. Thank you, Mary. Thank you for ordering that. If anyone's new, what Mary's talking about is I'll put it again in the chat. Right now, I just dropped it. There's a bundle where you can get my book and my journal from this website. I just put it in the chat. It's a promo they're doing. And if you buy my book and the journal, 100 of them will be signed. So I don't know if you have to click like get a signed copy or if it's just like the first 100 will be signed. So if you want that, get it now. Get it now. Okay, let me go back up to these questions. Ooh, Sally, tell me your question because I didn't see Paula's question. There was a former LPN who stole non-narcotic meds for 7 months from a resident, 50-year-old male. He was one of my spouse's nurses. Is it creepy, this place? His roomie died last month from neglect. Oh, precious, I'm so sorry. History lover, I'm glad you're here. And it's very normal to be scared of death. Doesn't mean, and the more you talk about it, the better it's going to be, and not to be pushy. I really am not being pushy. I really just think it's a good thing. If you actually are scared of death and you're not into reading, the journal would be good for you because the journal talks about stuff like that. But if you are into reading, my book's good too. They're both called Nothing to Fear. And you can get them now at that link I just showed you. Or you can buy them separately if you don't care if one's signed. If you don't care about the signing, you can just buy the journal. When you're experiencing the death rattle, are you already dead? No, you are unconscious. You're unconscious, but you're not dead. Julie, why do some individuals believe their past lives? Also, do you believe this is real, or are they making up stories? I have no idea, David. I kind of hope it's real. I hope past lives are real, but I have no idea. And I don't really know if I strongly believe in it or not. But that's just people's beliefs, right? Everyone has their own beliefs. Some people believe that they've had past lives and they're going to be born again, and some people don't believe that. And I just think it's a personal belief. Is it ever too soon to bring in hospice? Yes. If you are still getting treatment, it's too soon. If you don't meet criteria, it can be too soon. You can't just come on to hospice. You have to have less than 6 months to live, and you can't be wanting curative treatment. So if those two things are you don't want, then it's not too soon. But hi, for the people with terminal, Sasuke, which I'm probably saying your name wrong. I am going to not read your stuff out loud because that's not even, I don't even know what to say about it. Hi, Julie. Did you get the links for the Irish news article? Nikki, was it recent? If so, no, I have not. I have seen the stuff about the guy who's trying to live forever. What are your thoughts? My thoughts are the rich will do weird things. You know, I think it's okay. I mean, hey, if you that's what money will buy you, I guess. Right? He's super wealthy, isn't he? I think that's how you can do it. It's a little sad, but sad in the sense of like you can only do that if you're wealthy. That makes me feel sad. Oh, can you please share some of the contents of the journal deciding whether or not to buy? Yes, this is actually a fake. This is not actually the journal. This is like a fake copy of it because I have the journal, but I don't have an actual hard copy. They just took a regular book and covered it with what the cover is going to look like. But I do have the journal because I helped write it. So give me 1 second here. I'll pull it up on my phone and then we'll do that. If I was going to die, would I go on hospice? Definitely. I would still do all the things that would take to like treat whatever disease I have. You know what I mean? But if that option was there, I would definitely do it. 1,000,000,000%. Okay. One of my favorite parts of the journal. So it goes through like part one, becoming more comfortable with end of life, right? And choosing acceptance over fear. My experience as a hospice nurse has shown me that people who are willing to be honest about their feelings relating of the end of life seem to find the most ease and peace. When you think about the end of life, what comes up? What scares you most? Try not to hold back. Write what comes to mind. So there's stuff like that in there. There's stuff about what you would there's stuff like there's like existential things to think about and write about, but there's also practical things to talk about, like what you would actually want. Stuff you can show your family. This is what I want, this is what I don't want. Who do I want in the room? What do I want the room to look like? I love this one. It's called Permission Granted. Many people feel they have to use every means necessary for as long as possible to keep themselves. Roy. Roy, you're a good guard dog. Many people feel they have to use every means necessary for as long as possible to keep themselves or a loved one alive. But I want to give you permission to allow the dying process to happen. Below, write a permission note to yourself or to a loved one lovingly saying it's okay to let go. So that's just the very beginning of it. That's like a more of like the existential stuff, right? But there's also stuff where how to have difficult conversations, what would you want to be said, who would you want to be there. There's practical things with it too. So that's some of the journal. Do you experience VSED patients down there, specifically patients allowing? I have not experienced any VSED patients, but I preach about it all the time because I think it's a good alternative. Not a good alternative, but an alternative for people with like dementia and Alzheimer's, Parkinson's, things like that. I lost your questions. When you have loved one unconscious, always talk. Yes, always talk to your loved ones, even if they're unconscious. I will mention this at the next palliative care appointment. He's not seeking treatment, and we did hear that 6 months thing. Yes, 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 Rebecca, that'd be great. Marlene, I'm sorry I didn't answer your question. If you're still here, please keep trying, but if not, I get it. It's hard. Question, is your book in large print? I have problems reading small print. I don't know. I don't think so as of now. But you can get the audio book if that helps. Question, how do I talk with my dad about him dying? He is actively dying but still conscious. If he's actively dying, he's not actively dying if he's still conscious. Actively dying, I guess every once in a while you can be actively dying and still conscious, but if your dad is lucid and not has cognitively all there, no dementia, nothing like that, you could just say all the things you've ever wanted to say to him. Don't leave anything off the table. Just talk about how much you love him or what you've wanted to say to him. You don't necessarily have to say, particularly if you're not going to do anything different, like that he's dying, especially if he's not cognitively with it. I wouldn't worry about it. But if he is cognitively with it, you could say, Dad, I want to make sure I respect all of your needs and wants. I want to respect what you want. Do you want to stay here? And, like if your heart stops suddenly, do you want me to just let you go? Or do you want me to try to give you CPR to revive you? Like, it depends on how lucid he is and what you want to bring up. But if it's not really about like trying to find out what he wants, I would say just talk to him and try to say all the things you want to say to him. It's hard to answer this question not knowing the situation. When my sister was dying and was close to death, she sat up, gasped for air, and convulsing. It was very violent, scary. Is this something you have seen before? Yes, I definitely have seen stuff like that before. I think it can be misunderstood a little bit if you're not familiar with it, particularly if someone's young or they have something wrong with their brain, like if they have like a tumor. This can happen. It can be kind of like terminal agitation, or it can be seizures. I wouldn't say it's super normal. I'm really sorry you experienced that, but it can happen from time to time. My thoughts on visioning are, I think I know I don't know. I don't know. I don't know what it is, but I know it comforts people, and I love that. Yes. I know. Yes, Robin. MAID, medical assistance in dying in Canada. It is given through IV by doctors, I believe, right? Julie, what coping mechanisms does a hospice nurse when your patients pass without symptoms controlled? What coping mechanisms, mechanisms do I have as a hospice nurse when your patients pass without symptoms controlled? If you're talking about what coping mechanisms I have, those are really, really hard days. So I try to take a day off the next day because I need to take care of myself. Is that what you mean? How will qualifying for hospice affect one's civil rights? I don't know what you mean, Roxy. That makes me feel embarrassed that I don't fully understand the question, but I don't think it will, but I don't know what you mean. Can you give me an example? Signs someone dying from neglect would be they're not terminally ill. I think signs of neglect, you can die from neglect, I suppose, but it's mostly like if they have tons of bed sores and they're losing tons of weight, but there's no reason why. No, I have not seen someone come back and not need hospice anymore. Things that I still struggle to process about death and dying, even though I've seen a lot, is when we can't get someone's symptoms controlled and they die without their symptoms controlled. Or even when they're having a lot of symptoms, we give a bunch of medications and then it's finally controlled over here, but between here and here, they were still suffering. That's hard. So those things are hard to process. But it doesn't happen that often. Seizure during death process when unconscious. Any thoughts? I would try to give suppositories. They're called Diastats. Diastat has 4 different medications in them, and it helps them preventing them. It helps them stop having seizures and then preventing future seizures. Will you get someone to interview about people in nursing facilities? What do you mean, Precious? Can you explain just a little more? Oh, my thoughts on civil rights. Can they still vote if on hospice? Yes. If they are still of sound mind, they can still vote. How long to pre-order your book, Tina? Tina, you can pre-order. My book's not even coming out till June. So my book, Nothing to Fear, is out now. You can get it. You don't need to pre-order. The journal, you pre-order now. But you can wait until June when it's actually out. The only reason why I say pre-order now is 1, because it helps me. It helps me, and 2, because if you buy the bundle, the book and the journal, you will get a signed copy, the first 100. I just put the link in the chat again. No, glassy eyes are very, very normal. A lot of changes happen to the eyes. My husband was on hospice, never needed it, but was on it for 2.5 years. He was checked out, not bad enough for palliative. Not sure I agree. Yes, I do see that a lot too, Precious. I see that a lot. Oh, someone diagnosed with POTS received letter from DME revoking their license. That's tough. Yeah, I don't know. I don't know enough about that, if I'm honest. Yes, Darlene. Thank you for saying yes to the morphine, because I'm sure it really helped. Morphine does not actually kill the person or slow down. So morphine does slow down respirations, but doesn't result in death. So many people think because morphine slows down your respirations and people can OD on narcotics, that's what's happening. People who OD on narcotics, okay. 1, I have all love and respect for them. I am a past addict, alcoholic, so I understand. But in order to die from an OD, you have to take so much narcotic or so much morphine, right, that you stop breathing completely. You have a respiratory arrest, which then stops your heart. That actually takes a lot for that to happen. So, yes, the morphine we give on hospice can slow respirations down, but it is not slowing respirations down for them to have a respiratory arrest and die. So, it has been clinically proven. They have done studies where they have proven that the morphine given on hospice, which can fluctuate depending on the person and the disease, but generally speaking, the morphine given on hospice does not hasten or quicken the death of the person. It just makes them more comfortable. And a lot of times it slows the respirations down, but not enough to like kill them, but enough to make them feel better because they're not breathing so hard and they don't feel short of breath. So I hope that helps. Why does hospice bring a social worker to the patient? The social worker is to help with all the different financial things that they may need help with. Helping organize end of life stuff, where they want to be buried. Do they want to be buried? Do they want to be cremated? Helping with family dynamics. You know, you have one sister that's okay with everything, one sister that's not okay. Everyone's fighting, blah, blah, blah. The social worker can help with that. So the social worker is there for psychological needs, for financial stuff, for different programs you might qualify for. So it is normal, or it can be normal, for someone's eye color to change. And I do have a video about that. So if you want to look at my videos, you can look up eye color or something like that. I can't actually off the top of my head tell you why, but there is a reason why. Is it normal to still mentally view my sister as strong versus being sickly in hospice 3 weeks now? I haven't been able to see her yet. I learned earlier she's having trouble walking. I think it's normal when you're used to seeing someone not be sick to like forget that they're sick, or like not be able to picture them like them being sick. But I think you need to, when you go see them, kind of prepare yourself. Hi, Julie. End stage liver failure here, currently outpatient and living in a van. I was given months to a year to live as of September. Why won't my doctor give me meds to help with pain, sleep, anxiety? I have no idea. And so you have to ask your doctor that. I'm sorry. Ask your doctor that. There has to be a reason. I'm not saying it's a right reason or a good reason, but maybe a reason. I have a terminal illness and I have 3 years. What have you found helpful to tell your children and friends not to be fearful of the process of dying, eventually end of life? I think letting them know, I'm not sure how old your kids are, first off. So it depends on how old your children are. But no matter what age, you should still tell them. But the way you tell them will be different. But if they're older, I would say, speak openly. Talking about this will help me. And a lot of times I think knowing that it's going to help you helps them be a little more open-minded. It helps me if I can talk to you about how I'm feeling, what I think about this. I don't want to worry about you. I need you guys to know that I'm going to be okay no matter what, blah, blah, blah. I heard from hospice nurse Julie. You guys can always blame me, okay? I heard from hospice nurse Julie that we should talk about this. Here's what I want you guys to know, and that just get the dialogue going. Hi, Julie. Do they give the morphine based on the current weight? Sometimes, but generally speaking, we're literally giving like the least amount of morphine we possibly can. So it doesn't matter the weight, because it's like there's barely that we're giving such a small amount. But we can use weight sometimes, and we also look at their kidney function. Yes, we do believe people can still hear you at the end of life. And yes, people can kind of hang on if they're waiting for someone to visit. I've been on Suboxone for 18 years. If I need hospice, would it kill my pain? Hate death, older, 62, 22. Suboxone might help you. Yeah, you'd have to talk with the doctor. You'd have to talk with the doctor. They would work with you. We would figure it out. What do you suggest for drooling? He was on atropine. Then MP had him on a patch. His neuro said it would make him memory worse, which I noticed took him off, but now drooling. It's hard. It's hard to know, Precious. It's kind of like a give and take, risk versus benefit. Like sometimes, like, if he doesn't have to be on a bunch of meds but drools, okay. If the drooling really bothers you or them, then they can try to be on medication, but it's a risk versus benefit. Maybe allow them to drool? Is that bad? The patch might work a little bit. Repositioning sometimes. There's no easy answer sometimes, unfortunately. Hi, Nurse Erin. So there are 4 different medications that we mix together for the Death with Dignity medication. It's the medication that is legal in 11 different states in the US. You have to meet criteria, which is you have to have less than 6 months to live. You have to see 2 different doctors at 2 different times who basically medically and mentally clear you You have to prove that you're a sound mind and can physically take the medication, and then you can get it. It is a mixture of 4 medications that they do based on your height and weight and things like that. However, I don't really feel comfortable telling what what the 4 medications are, but it should be an easy Google search, Aaron. So I'm surprised you haven't been able to find it. You can like Google it. I don't feel comfortable being like, it's this medication and this, but just know that it's 2 sedation medications. So 2 medications that completely sedate you. And then it's 2 medications that can be used in regular everyday life for heart conditions, but they are given at lethal doses, so they stop the heart. And it's very peaceful. It's not painful. Thank you for everyone who's answering in the comments. I really appreciate it. Thank you, Beth. Thank you for being here. Thank you for being there for your husband. Welcome, everybody. I'm just trying to read through the questions best I can. If I'm not answering your question, you've been really, really trying, please send it in all caps. Some of the things I see in all caps, if I've spoken to you a bunch in the chat, I'm probably not going to keep answering your questions. I'll probably try to move on to other questions if you're wondering. Lisa White, Lisa White. So if you're ever on hospice and you need pain meds, but you've been on Suboxone for 18 years, they may still be effective. However, they could. So this is what I mean. Like, I can't give you like medical advice, right? The time hasn't come yet. But what I do know is hospice would be willing to really, really work with you. We work with many people who have been on Suboxone, who've been on methadone treatments, who've been in addiction, out of addiction, a bunch of things. So it's not like our first rodeo. We might try to wean people off the Suboxone so we can get them on pain medicine. Sometimes they can stay on Suboxone and we add stuff and it will still help. So it just depends. But people on hospice, the doctors on hospice, we are all very, very skilled, and we're very, very skilled at pain management. And we've seen a cajillion million people who have been on Suboxone, methadone, in and out of treatment and not wanting to be on narcotics or afraid to use narcotics. There's just a bunch of stuff. So that we can help everybody. Not always easy, but we can. Most peaceful death, a lot of times, is end-stage kidney disease, because the calcium levels just rise and the person basically just falls asleep. It'd be really peaceful. What do you not like about being well known via YouTube, KC? To be honest, I don't really notice it that much. I don't feel like I feel well known. One, I don't think I really am that well known. And two, I live in Los Angeles where like people are like actually famous here. We have like Brad Pitt like walking around the streets. So there's like people like that walking around. So no one ever, very rarely does someone ever like stop me on the streets. Sometimes they do, but not much. Hospice patients cannot donate their organs. They can donate their bodies. They can donate their eyes. They can donate their brains, but they can't really donate their other organs. I'm doing the best I can here, trying to look through all the questions. I'm sorry if I'm missing stuff. I'm sure I am. Can you address the hospice patient moaning like they are in pain when pain meds are on board for actively dying? My brother was bothered. Yes. Okay. So a lot of times the moaning can be one, terminal agitation. And a lot of times if it's rhythmic moaning, It's a self-soothing mechanism. Self-soothing mechanism. Pink cameo. Or pink camo. I did not read your question, but I keep seeing everybody else say, thanks, pink cameo. I don't know what you said. Or pink camo. My mom has terminal met cervical cancer, mainly affecting lungs, now having 1.5 liters. No one telling her what to expect. She's struggling with this. Any ideas? I just burped. I'm sorry. And it's because I'm drinking Topo Chico. My idea would be whichever doctor is like following her the most, right? So if it's the oncologist, I would say it's probably the oncologist. I would ask them, like, go with her and you guys all sit down and ask them, hey, say this exact thing. Say this exact thing. We don't know what to expect. We are really struggling with like what to expect. Am I going to die from this? Am I not? We want to have an open, if you do anyway, we want to have an open dialogue about what to expect. It makes me feel better knowing what to expect. I can't read this, Christina, and like know what to expect, or otherwise I would tell you. I need to know a lot more. That's why you have to talk to people who are working with her. But try to have like I really want to have an open, candid conversation about this. If you guys do. But you can watch a lot of my videos. I have general videos like about like what to expect with end stage cancer. Now I have no idea if hers is end stage. You did say it was terminal. So if it's terminal end stage cancer, and they know that, eventually I would just take each day as it comes, right? And expect that she's going to be more tired, eating less, more tired, eating less, drinking less, being able to get up less, being more and more tired, more and more sleepy, right? But start preparing for that now. Start talking to her doctors now about like, how should I prepare the home? Who's going to take care of her when she needs someone to take care of? Is it going to be me? Like stuff like that. No, it doesn't hurt to die. It doesn't hurt to die. There's diseases that can be painful and certain types of diseases that can be painful. And the diseases you're dying from can cause symptoms, but dying itself, I wouldn't say hurts. Oh, Pink Camo asked about the difference between leukemia and multiple myeloma. I know. And you know what? I remember that question and I can't, and I don't, and oh, Robin, I don't know. I don't know. The longer I've been a nurse, I mean, I know ish, right? It's like, I know ish. And I don't want to be someone on the internet who like doesn't know something very well or isn't an expert at something and starts like jabbering off the jaw about something, because then that's how misinformation gets started. So I am not a like blood cancer guru or the thing I know a lot about different types of cancers are like what end stage stuff looks like. So different blood cancers, none of the blood cancers end stage, which not some of them aren't terminal, but some of them are, stick out to me, which means there's not a lot of symptoms with it. And if there are, it's probably shortness of breath and maybe pain. That's usually what it is. But so if it doesn't stick out to me, that means it's usually pretty standard, which means I don't see it that often, one. So I don't see it that often. When I do see it, it doesn't stand out, which means it probably was not tons of symptoms to manage. That is my time to go. Not a lot of symptoms to manage, and it's pretty typical, meaning not eating and drinking, sleeping all the time. Not eating and drinking, sleeping all the time. So it's very general. Okay, it is time to go. But before I go, you guys, remember, my journal is out. It is, you can buy the bundle. I'm going to put the thing in right now. You can buy the bundle. First 100 will get a signed book, not journal, a signed book by me. And the journal is out for pre-order. And if you're interested, get it. If you want to help me, get it, and get it pre-order if possible. And you don't have to buy the bundle. You can just get the journal if you already have the book. Okay? All right, you guys. Mwah. Thank you. I'll see you next Thursday. You guys are the best.